Andrew is one of the few lifelines still available to Manchester's struggling opioid addicts.
I have needles and Narcan if anyone needs any.
Help centres have closed and resources cut off because of the coronavirus. New Hampshire's opioid epidemic that killed more than 400 people a year at its peak risks being sidelined by another health crisis.
I don't know anyone that has COVID or has got COVID or has died of COVID, but I have a long list of friends that are all dead because of opiates. I would say the fentanyl problem is a much worse health risk than COVID ever was or will be.
You can't get help. The only help people we have is the clean needle exchange. That's it.
For Leah, a homeless mother of 3, the coronavirus shutdown has left her even more vulnerable to drug abuse.
I'm around the usage all the time now. That's all I'm seeing, that's all I'm around now, and I'm constantly wanting to use. I'm constantly around it, and there's nowhere I can go that's safe.
From the park, Andrew takes us to a tent city on the banks of the Merrimack River.
Why don't you guys just wait here? I'll go up and see how everybody's doing.
It's still bitterly cold, but homeless people are leaving council shelters because they're worried about getting COVID. That exposes them to other dangers.
So we've come to this homeless camp here, and we're hearing that one of the people who lives here has died, probably of an overdose.
I had read about it happening, but I didn't know who it was, and I just talked to his sister, and so people are in kind of a bad place down here, I guess.
Elsewhere in the neighbouring town of Concord, some facilities are open, but limited by staff working from home. That doesn't stop the emergencies.
And we do have a person in there who is currently suicidal, and we're trying to get her some help as quick as we can.
Without support, the woman has suffered a relapse, and staff know she's not the only one.
All of us in the treatment world are really trying to say, how do we prepare for the inevitable? Because we know we're going to see a spike, but what is that spike going to look like?
While we're filming, the police arrive to take the woman to hospital. Her carers are upset, but had little choice. She was threatening to harm herself and others. They know she'll be safe for at least one night, but nobody knows what will happen after that.
Around here, COVID might have shut things down, but we're still here. Emergencies never stop.
Jane O'Brien, BBC News, New Hampshire.